Good day, ladies and gentlemen. I would like to welcome all of you and to thank to all the participants for being here today in the European Parliament at the first European NASH-NAFLD Policy Summit, kindly hosted by member of the European Parliament, Mr. Alois Peterle. This summit has been organized by ELPA and in partnership with EASL. As the President of European Liver Patient Association, I am honored to welcome policymakers, patient advocacy groups, experts and decision makers from across Europe to discuss the next major public health challenge that Europe will face. Non-alcoholic fatty liver disease, known as NAFLD, refers to a group of conditions where there is an accumulation of excess fat in the liver of people who drink little or no alcohol. People with NAFLD may have a more serious condition named non-alcoholic steatohepatitis, known as NASH. NAFLD is one of the most common causes of liver disease worldwide, representing a major global public health problem and placing a significant burden on the sustainability of our healthcare systems. NASH will become the leading cause of liver transplantation in the next 10 to 20 years. In the United States, NASH is already the third most common indication for liver transplantation, surpassed only by hepatitis C and alcoholic-related cirrhosis. NAFLD usually is seen in people who are obese, overweight, or affected by type 2 diabetes and hypertension. Obesity and diabetes are on the rise around the world. The World Health Organization estimates that more than 1.9 billion adults are overweight. Out of these, over 600 million are obese, with 42 million children under the age of 5 are overweight or obese. The total number of people with diabetes is projected to rise to 366 million in 2030. This means that we could be facing an epidemic of NAFLD and Europe will not be exempted from this. The liver community and those working against related diseases, policy and decision makers, and the other interested parties cannot stand by and watch. It is time to take action to establish effective policies, to early detection and effective therapies, and put more effort in prevention policies across the European Union to combat NAFLD. Today's summit is the first European policy event on non-alcoholic fatty liver disease, bringing together all relevant stakeholders in the field of NAFLD. Our aims today are to explore how to reduce the burden of the disease, to mitigate the impact that this will have on the sustainability of the healthcare systems, and what concrete steps need to be taken to tackle this new public health challenge. NAFLD-NASH are seen as lifestyle conditions, and the socio-economic costs are not fully recognized. These diseases are not a policy or treatment priority in the EU, which focuses on prevention. Liver disease strategies are missing or not implemented across Europe. The seriousness of NAFLD and the potential impact it will have on healthcare systems needs to be recognized and addressed before we encounter an epidemic across Europe. This summit is intended to trigger a serious debate around NAFLD to increase the policy focus on this imminent public health challenge that Europe is facing. This summit will not be a standalone event. We will work together with the broader community to identify the right policy responses, keeping the patient at the center of all our actions. I hope that this meeting will mark the beginning of the engagement for each of you to find effective policy answers to change the environment around NAFLD-NASH to ensure the patients affected by the diseases won't be left alone. With all these objectives in mind, I wish you a very fruitful discussion, and I am looking forward to working with all of you to face this new challenge and to assessing our progress during 2018 NAFLD-NASH Summit.